Welcome. I appreciate you being here. Over the course of our administration, we've continued to place an emphasis on confronting our county's fiscal challenges head on. As the pandemic gripped Howard County and the rest of the world, in March of last year, it was clear that we needed to take smart yet aggressive fiscal action. Amid mounting uncertainty, we made difficult budgetary decisions to reduce the anticipated fiscal impact of the virus on our communities, including an internal government hiring freeze and reductions to spending on contractual supplies and services. By making those tough decisions and meeting our fiscal challenges head on, we were recently able to secure our 24th AAA bond rating and making Howard County just one of 47 counties nationally to earn that distinction. Our school system's health fund deficit represents another significant fiscal challenge that our administration had to confront upon taking office. Over a 4-year period, from the end of fiscal year 2015 to the end of fiscal year 2019, our school system's health fund balance went from a $1.6 million surplus to a $39.2 million deficit. Our fiscal challenge was significant enough that our external auditors took notice, issuing a modified adverse opinion for our school system in its fiscal year 2019 CAFR. And based upon those indicators, it was clear that our current path was not sustainable. And decisive action was needed to meet those fiscal challenges head on. Working collaboratively with our partners in the school system, in early 2020, we developed a multi-year plan to eliminate this deficit by the end of fiscal year 2024. Using unassigned fund balance, year-end savings generated by the school system, and one-time funding contributions from the county budget. This plan was developed through months of dialogue between our respective staffs, and the result was sustainable and a shared effort to address this glaring financial issue. We took immediate action to implement our multi-year plan, filing legislation in February of 2020 to permit the use of $7.2 million in unassigned fund balance to reduce the school system's health fund deficit, which passed our county council unanimously. Based on the development of a joint multi-year plan to resolve the health fund deficit, supported by the decisive action by both the county and the school system was able to secure an unmodified CAFR in fiscal year 2020. Receiving an unmodified opinion in fiscal year 2020 was an important milestone in validating that our collective actions were moving our county in the right fiscal direction. And the $39.2 million deficit that faced the school system's health fund at the end of fiscal year 2019 has been reduced to $18.7 million, marking $20.5 million in progress toward eliminating this deficit in less than 2 years. Today, we're here to announce the big next step toward meeting this financial challenge head on. Continuing to reverse the course of a near $40 million deficit generated over a 4-year period and making progress toward eliminating this deficit once and for all. In our proposed fiscal year 2022 operating budget, which will be released in full this coming Monday, I will be allocating an additional $10 million to continue progress toward eliminating the school system health fund deficit. This action will place our collective efforts well ahead of schedule set forth in the multi-year plan, which called for an elimination of the deficit by fiscal year 2024. And we are optimistic that with additional year-end savings from the school system, that this deficit may be eliminated completely in the near future. I firmly believe that the mark of good leadership and good governance is how we respond to adversity, how we overcome challenges. Working together, our administration and the school system faced a daunting challenge. We met it head on, and we're making significant progress. I'm proud of the work that we've done to address the health deficit, and I'm thankful to have partners like Dr. Martirano, our superintendent, and our Board of Education to make this deficit elimination possible. And now it's my pleasure to bring up Chair of the Board of Education, Dr. Chow Wu.
Thank you, Dr. Bo. Good morning. On behalf of the Board of Education, I want to express deep appreciation to the County Executive, Dr. Bo, for his support for our school system. The county's contribution of another $10 million to apply to the remaining health fund deficit will greatly help our system to get closer to achieving removing this financial burden, which has strained our budget and limited the funding available to apply to our priorities. I commend our superintendent, Dr. Martirano, for his leadership, which has unwavering commitment and efforts. First, by raising the alarm about this deficit 4 years ago, and then by working tirelessly ever since to stabilize the budget and reduce the deficit on such aggressive timeline. Through Dr. Martirano's leadership and efforts, our school system has fully funded our health care obligations each year and found savings whenever possible to reduce the deficit. 4 years ago, Dr. Martirano, as an acting superintendent, was the first person to publicly raise this issue before the county council and ask the board and the county leaders to make this a priority. We appreciate the partnership of the county executive and the county council in making deficit reduction a priority. Much credit is also due to our school system staff who have been diligent in their effort to find their budget savings and streamline expenses. We also appreciate our board members' focus on eliminating the deficit and examine our spending closely. With all the effort, elimination of the deficit burden is finally in sight. We must now focus on efforts toward ensuring that our budget remains sustainable, and we look forward to building a fund balance in the health fund to avoid future instability. This is critically important to set our system on firm financial course and help weather the budget stress and the uncertainty related to health insurance cost increase, which has been a problem over the last few years. Thank you again, Dr. Bo, for strong and consistent support for Howard County students and parents. Thank you.
Good morning, everyone. I'm Dr. Martirano, the superintendent of the Howard County Public School System. And I want to thank Dr. Wu for your words and your leadership as well. But before I start, County Executive Ball, I want to thank you for this outstanding announcement today, for this contribution of $10 million, which makes a huge step forward in eliminating the remaining deficit for our employee health insurance fund. The deficit is a result of many years of underfunding the healthcare expenses, and it has long undermined the school system's sound fiscal condition and caused an adverse audit opinion by our external auditor on the FY 2019 books. It has limited the funding available to direct to the instructional priorities and student supports. When I became superintendent nearly 4 years ago, I quickly became aware of the accumulated deficit and realized its dire significance. Eliminating it and fully funding our health care obligations have been among our highest priorities ever since. At that time, the deficit was projected to grow to over $50 million, and it ultimately reached $39.2 million. The first step we took to stop the bleeding was by fully funding employee health insurance costs in the budget. Since then, it's been non-negotiable, and we do that each year. We have also been diligent in cost-cutting wherever feasible to pay down the deficit. This has required us to work with the Board of Education to cut significant funding from prior year budgets to fully fund our obligations moving forward. I want to thank the Board of Education for their commitment and acknowledge the difficult decisions we've had to make together to reduce positions, programs, and services to address budget shortfalls over the last 4 years. Through these efforts, we were able to stabilize the health fund. Let me say that again. Through these efforts, we were able to stabilize the health fund. I also want to thank our employee groups, and we have with us today Ms. Colleen Morris, the president of HCEA, who has worked hand in hand with us to reduce the health care costs and address the major structural issues that existed within the health fund. Once we stabilized the fund by appropriately funding it based upon actuarial projections, we directed staff to eliminating the deficit, our number 1 budget managing priority. In FY 2020, we reduced the deficit by more than half, from $39.2 to $18.7 million, a $20.5 million decrease. This reduction was the combined result of health expenses that came under budget, budget savings due to our budget management and budget control measures, and the use of $7.2 million from the Howard County Public School System fund balance. As a result of these actions, the school system received a clean audit opinion for FY 2020 as mentioned by our county executive. This year, we are on track to achieve additional budget savings, which will help further reduce the deficit. The partnership and support of County Executive Ball has been essential throughout this process. Last year, we set out the framework of this partnership to eliminate the deficit over 4 years. Our efforts in fiscal year 2020 and now this significant boost from the county will help us accelerate the timeline to fully eliminate the deficit so we can focus on the efforts on building a fund balance and ensuring the school system remains on solid fiscal footing. I want to highlight that while our efforts to reduce the deficit are not a celebration on its own, they are a monumental step towards financially grounding the school system. This puts us on a firmer platform to weather budget pressures over the next several years. This is critical just because one more year of higher than expected claims could set us back significantly and require us to cut even more. County Executive Ball, the $10 million county contribution will bring us far closer to ultimately eliminating this financial burden on a much faster timeline than we originally deliberated in our elimination plan. Again, I want to thank you for your leadership and for your collaboration to make this possible. And again, I want to thank our association, Ms. Colleen Morris, and our Board of Education, as already has spoken, Dr. Wu, our chair. As always, we greatly appreciate the support and partnership of all the individuals in our community in addressing the funding needs of our system and supporting our system and our schools, and mainly our students. Thank you very much.
Good morning. I want to again thank Dr. Ball and Dr. Martirado and the Board of Education. My name is Colleen Morris, and on behalf of the 7,000 employees that we represent, we are so grateful to Dr. Ball for this money for our deficit. I'm not really sure, as our leaders spoke, if you really felt the challenges that, that existed when Dr. Martirano took over in May of 2017. That when you come in and you find out that your school system hasn't been funding the employee health care and you need to add 30% to that health care fund and you need to eliminate the deficit that's been caused by that, it's an extreme challenge. It creates lots of strife. Where is the money going to come from? As you know, as Dr. Martirano spoke, we've had to cut positions, we've had to cut staff. So from the bottom of my heart, and all the employees, we are so grateful that we won't have to do that yet again. It's a benefit to our students, it's a benefit to our families, and it's just a huge leadership collaboration that I'm at a loss for words to express how grateful I am for this. For all of our students, on behalf of all of our educators, thank you so much.
Do we have any questions from the press?
Yes, for those who may not have been around 15 or earlier, how do you explain the whole health fund and how we got to that point? Maybe that's Dr. Martirano. Maybe that no, it's not. I mean, people who may say, well,
I'll respectfully defer.
Thank you, sir. I appreciate that. Once again, good afternoon. I'm Dr. Martirano, the proud superintendent of the Howard County Public School System. What I want our community to understand, that we are self-insured in a very technical way. We have to put enough money in our budget to cover the promises that we have made to our employees to cover their health care benefits. And that represents about $160 million plus in our budget. If there is any deviation from not funding that fully, creates an ongoing deficit. And to balance other priorities in the budget, previously decisions were made to make adjustments to that and then make up for it the next year. If those decisions are made, they become cumulative. And so in May of 2017, when we realized that, all working together, that there was an incredible deficit, structural deficit occurring within our budget, we recognized our first action was to fully fund our obligations for health care, to ensure that what we promised our employees, because as a school system, with family members, et cetera, we provide benefits for over 20,000 individuals. And that is an incredibly awesome responsibility. We must fund that, and we cannot, by law, run deficits within the school system's budget. So our first commitment, working with our county executive, with our union leaders, and with our Board of Education, was to make a commitment to fully fund that, and then to be able to then systematically tackle the elimination of the deficit. And our ultimate goal, my ultimate goal, is to get us on solid footing where we have an actual fund balance. If we experience any aberrations or deviations in years based upon claims or high-level claims, that we can make that adjustment internally. And it's fiscally prudent, it is the right thing to do, and we can never find ourselves in this position again. Because in the long run, those dollars that we have been applying to this, I'm sure that we could have found other ways to spend that money to support our children and our teachers in the classroom. Thank you.
And Dr. Ball, would you say, now that we're at this place, there's some safeguards in there to say, we always hit the line, it'll never happen again. But what is in place to kind of say, here's some protections?
So from moving forward, since we discovered this aberration in 2017, we have been funding the health fund fund balance at the appropriate levels and have been working collaboratively to bring it down. The goal was to actually eliminate the deficit by FY 2024. With this infusion of $10 million, the goal now is to move toward elimination much faster and to ensure that we continue to fund it at the appropriate levels and never find future superintendents, educators, boards of eds, or county executives in the place in which we found ourselves. Any other questions from the press? All right, this ends the press conference. Thank you.